Hey guys, if you haven't already heard the news story about how there's a rare disorder that causes people to see faces as demons, which is basically predictive programming for them force medicating and putting people in asylums when the veil thins and we can actually see the demons. And in that video, I mentioned something about true empaths being able to see or detect these changes before the regular person would. And Jesse asked a perfectly legitimate question: do all empaths, quote unquote, have childhood trauma? And if so, is it possible they just have PTSD and not cause the hyper empathy, hyper awareness? Yes. So I take a little bit of umbrage with the term empath too, because I think sometimes people use it to represent something it's not necessarily supposed to mean. The development of empathy is supposed to solidify in children around the age of 5, but because of years, decades, generations of MK Ultra programming and poisoning and all of that, I think people's ability to feel empathy has been shut down to a very large degree. So when I say an empath, I mean people that are outside of that standard programming, that have a little bit more self-awareness, that can read a room or kind of tell when something's off. But we've all had that experience of walking into a place and you can tell that the people were just arguing or something. You can feel the vibe in the air, if you will. So yeah, I think most empaths do have trauma, that is part of their hyper empathy and hyper awareness. However, I also know there are valid medical things that I think can lead to this, and this is where I'm definitely conspiracy tinfoil hat on. So I have a genetic mutation, and it's MTHFR, and it has to do with being able to methylate folate. And because our nerves are covered with this myelin sheath, if you carry the MTHFR genetic mutation, that means that over years, decades, a lifetime, the myelin sheath, that which coats the electrical nerve signals in your body, begins to wear away. This means that you truly begin to feel things on a deeper level. I myself have found that my ability to sense or detect awareness has gone up the sicker I've gotten. So, I started trying to course correct some of these things, but some things can't be undone, like genetic mutations. It just is what it is, and it has to be managed appropriately. Anyway, we're off topic now. Empaths, yes, I think empathy is a result of trauma most times, and I think you can learn to hone it and use it for the best of your abilities to serve others, hopefully. All right, stay well, Jess. Bye.